Hey, greetings everybody. What's going on, Singapore? This is Dr. Brent Maxwell, or Dr. Max. Anyways, thanks for joining us for this workshop. Now, this time right now, you'll notice all around us that healthcare, or the way that it's delivered, has been changed because of the COVID crisis. It also changes the way that we receive healthcare as well, too. In fact, in Singapore at this time, all chiropractic clinics island-wide have been closed because in this country, chiropractors are not seen as essential workers or providing essential service at this time. Different in other countries, but in Singapore at least, we're not given that same status. So at this moment, all of our clinics or all of our offices are closed at least until June the 1st. Hopefully no longer than June the 1st. So it is what it is. So even though that we don't have our physical offices to help you with your hands-on care, that's what we typically do as chiropractors, we had to reinvent a way to be able to provide some value or service or add some value to your health and life. And this is the next best way of providing content and knowledge and information through an online webinar such as this. So if you have any questions at all throughout this webinar at any time, feel free to enter the comments or concerns or anything related to what you hear, or if you have questions for yourself, enter it into the comments box below, because this is going to be broadcasted on YouTube. Or if you're watching this right now, you're more than likely watching this on YouTube. And we will have somebody, either myself or another one of my teammates, we're going to reach out to you and answer those questions and concerns that you have through this forum. So I'm ready to get started with this. So we are aware there's a population of non-COVID sufferers who are living in with chronic issues of the back and lower back, typical lower back, that's been affecting their daily life, either at home or at work, with families, or playing with the kids, or being able to participate in their activities. So if it's interfering with your life before COVID, definitely it's not going to get better by the time you finish COVID, unless we're intervening in the meantime. So that's the reason why we're having this workshop, specifically this online webinar called Bulletproof Your Lower Back. Yes, bulletproof. This is one of many monthly workshops we teach to our clinic clients, or our clinic, our patient base, on various different body signals your body warns you about when there's some underlying problem. So I want you to think about what's going on in your back and your body at any given time. Now think of what you do for a living. You might be a parent, you might be a caregiver, you might be an executive, you might work in food and beverage, you might even just be a caregiver. Okay, whatever it is that your job that you're doing, if it's changing, if the issues of your spine, of your back that you feel is changing how you do your job, or how you exercise, or how you even get up and move, it's interfering with your day-to-day quality of life. It's not necessarily stopping you, but if it's in your mind, it's interfering with your quality of life. Meaning that if you had a choice to live without it, you'd rather live without it. So now's the time to not only just to find a way to look after the pain, but let's go and find out what's causing it in the first place. So that's what we're going to dive into, the underlying root cause about why this issue that you might be living with is coming back again and again. So now this workshop is for you if you've ever experienced any type of low back pain or tight muscles, or if you lost some range of motion to how you move your body from left to right, bending forward or turning side to side. Or perhaps you notice an overall level of stiffness that doesn't seem to go away. You notice it in the morning when you wake up, or you notice it at the end of the day. Either way, stiffness should not be there, regardless of your age. Leg pain that doesn't go away. You notice it when you go for long walks, you go for short walks, or just inhibits how you get around either your job or just for leisure, or just if you're going to shop. Perhaps you notice that you have swelling in your extremities, lower extremities, your ankles, your feet, your knees, your lower joints as well, and it's not going away, it's not being helped. Or even sometimes, have you ever had a burning sensation in your feet when you walk, when you step? Okay. That's a problem. Even go one step further, if you ever notice that you have a numbing feeling, meaning that, or I guess what they say in Mandarin, ma pi. Basically, it's a numbing feeling that when you walk, you notice it every time that you walk, that you step, and it's hard to miss. If any of these have related to you, or if you've experienced any of these whatsoever, this is what this workshop's all about. What led up to that point, or what you can do to make sure you don't get there again. All right, let's start with some basics about your lower back, basic anatomy. Okay, we're not going to go into too much detail, not going to go too medically, but here's what everybody needs to understand. Your spine is made up of three regions: neck, mid-back, and lower back. Your lower back is the foundation that carries the majority of the weight of your spine of your body. Okay, so the greatest weight-bearing joints of your spine is your sacrum and the 5 segments of your back: L1, L2, L3, L4, L5. Okay, together they're designed to provide stability, mobility, and protect the vital nervous system structure called your spinal cord and your nervous system. It's your lifeline. Okay, so your spine does its best. Okay, when it's aligned in this position. So if you're standing up straight and your hips are level, that's what you look like this. From the side, when your spine has a curve and arc like in this position, like this, then it's able to act as a suspension to prevent any type of additional damage to the discs, and all the force from when you're sitting, standing, carrying, any type of gravitational force is absorbed by the curve. So curves are critical. They're your body's natural stress dampeners or force dampeners. You need to have that in the lower back. If you don't have enough of it, all the force goes into the discs, which also disrupts and damages anything in between, specifically the nerves. Okay. If you have too much of a curve, a lot of people start to have an overemphasis of pressure on the lower part of their back if the curve's not in the proper line, either excessive curve or they call hyperlordosis. So any of these imbalances, either lack of curve or excess curve, hyperlordosis, not only can create chronic low back pain or inflammation or irritation or an ache, it can lead to something even more serious, even more annoying, called a disc herniation. Now, disc herniation is next level back pain. And if you ever had a herniated disc, you probably remember that feeling. It stopped you in your tracks. Painful. Ever heard of the term, the straw that broke the camel's back? That's called an idiom. And that refers to, it wasn't just that one straw that caused the spine to break of the camel, but it's the millions of straws that have been loaded up over time that led to that breaking point from that extra one straw. So if every single day you're using your spine in a way, your body's in a balance in a way, or imbalanced in a way, it might be hyperlordosis, which is lack of that curve, lack of that spring, or you might have that one spot that is actually hyperlordotic for such a long time. Or perhaps you might be running and training, being an athlete, and there's a shift and there's a rotation somewhere in the base of your spine, and you're loading it on a constant basis, and you've never had that checked before. These are the conditions that lead up to that disc herniation. In fact, here's what it looks like. The next level beyond that is sciatica, which means that herniation not only irritates the nerves and creates inflammation, creates a lot of pain locally, but herniation also interferes with one of the longest nerves of your body that extends from your lower spine here, this outlet where the nerve exits your lower back, L4, L5, travels down your leg, through the pelvis, goes all the way down past the knee, into the feet, into the legs. When you have sciatica, it feels like a sharp shooting pain every time that you walk, that you step. It stops you in your tracks. Any type of pain pattern that refers or travels down the leg is not good. 95% of the time, that pain pattern can be traced all the way up to originating from your spine.
Now, here's a typical scenario in Singapore, at least. When you have that lower back issue or a disc issue or herniation or sciatica, whatever it is that's interfering with your life, you end up in your primary care physician's office. When you end up there, they're going to give you some solutions or at least some choices for you to pursue. Those choices typically involve either, hey, bed rest, or start applying heat. Perhaps that choice may also go into recommending physical therapy for a trial of care. Now, if those concerns don't go away and they come back again and again, and you end up at your primary care physician's office again, here's what you can expect next. The intervention is going to escalate. Either they're going to start recommending a muscle relaxant. Usually muscle relaxants are really acute spasms, right? That's more of a short-term relief. However, the next level up from that might be injections, steroid injections to ease the inflammation and control the pain. Or perhaps if those injections don't work again and again, then you might be introduced to a course of chronic pain management, which is another level of medicating your pain to subdue the symptoms. And that medication is often stronger, use stronger medications that involve opioids, which has to be monitored very closely by a medical doctor, and also very addictive as well, so there's a risk there. If And when that fails, meaning that the pain doesn't go away, the symptoms don't go away without the medications, and now your body continues to feel pain despite drugging yourself up, the next level of intervention is going to be surgery. So in Singapore, here's what I've noticed. People are deathly afraid of surgery. They want to avoid it at all costs. So perhaps let's try the traditional Chinese medicine approach. So typically by TCM, they're going to provide either acupuncture for the pain, or perhaps they're going to do cupping. Sometimes they also recommend gua sha, which is the scraping of the skin to promote blood flow, which also creates inflammation and healing. Other times might involve tuina, which is a Chinese form of manual medicine, Chinese manual therapy. So cupping, acupuncture, gua sha, tuina are the most common approaches that are used within TCM for low back pain. Okay, I just listed a whole series of options that's made available to you by a medical doctor when you have low back pain. But here's what's limiting each of those options. A, bed rest. It's good for a certain limited amount of time, but too much bed rest creates muscle atrophy, which means your muscles forget how to work. The muscles that support your spine forgets how to work. And also you prevent imbibition, which is your ability for your discs to absorb water and nutrients so it can nourish your nervous system, nourish your joint, exchange liquids. So imbibition is inhibited. Heat. If you have inflammation, you don't want to add heat to this. It's a bad idea. Okay, you got drugs to mask the symptoms, which work to mask the symptoms, but as soon as the drugs wear off, you're still left with the same problem. It's not corrected, it's not fixed. The underlying issue hasn't gone away. Okay, physical therapy helps with the soft tissue that's surrounding the problem area, but it still does not address the underlying biomechanics or correct the underlying biomechanics that led to the problem area in the first place. Steroids, yes, they work. They suppress inflammation very effectively. However, steroids are not relegated to only the area of pain. It goes throughout your whole body and suppresses not just inflammation, which is needed in some other parts of your body, it also suppresses the immune system. It also causes long-term tissue damage, long-term joint damage. So steroids is not intended for long-term, steroids are only intended for short-term relief. What about the chronic pain management option that involves narcotics and opioids, basically stronger medications to suppress long-term pain? Yes, it works, but unfortunately it's crazy addictive and it has a damaging effect on other organs of the body, the kidneys, the liver, and also the mind as well too, making permanent changes to your nervous system as well. Now, I'm saying this even though that there's an opioid crisis in America right now, Singapore is not that far off. Finally, the last option is surgery. You also deserve to ask the question, doctor, what are all my options that's available to me? Before you go down this surgical route, you have to ask some serious questions to your medical provider or anybody who's advising you on this. Like A, what are the risks that are involved? Or what are the costs that are involved? Or what are the expected outcomes for this type of procedure if it's done? Or you can ask your doctor, hey, do you know of anybody who had this procedure they can recommend, that can speak to? Getting almost like a recommendation or referral of people who've had the exact same procedure as well. Ask around. Ask people who've had spinal surgery. Ask them if their quality of life is better or the same or no different. Is the surgery intended to cover the symptom or to fix the cause of it? These are serious questions that everybody needs to ask before any type of medical intervention, especially the surgical path is chosen. Now, another important question you got to ask or wonder is, has your primary care physician or surgeon even recommended chiropractic as a possible option to you before surgery? If that has never been recommended to you by a medical doctor or by your physician, chances are they don't know enough about it to recommend it. They either never experienced it before or never interacted with anybody involved in chiropractic at all. Or they had little or no education about chiropractic itself in their schooling. So don't blame them, they just don't simply know. So if you've been living with low back pain, or you've been living with tight muscles, or perhaps you have a loss of range of motion, how you move, how you bend, and how you get around on your day-to-day basis, getting out of bed, getting out of a chair, or getting, whatever it is that you're doing. You feel like you're not as flexible as you used to be. Perhaps you have some stiffness in your lower back that's not going away at all. Even perhaps you ever experience leg pain that comes back again and again and again, comes back. Any leg pain is not normal. Or perhaps you notice that you have swelling in your lower extremity, or a burning sensation anywhere along your legs or lower body, or even numbness anywhere along the path of your lower back, extending anywhere along the pathway towards your feet. Think of those problems that you've experienced as signals, body signals warning you or trying to communicate with you, letting you know that there's an underlying problem that needs to be addressed. So the signals aren't the problem. The signals are only alarm. The underlying problem has yet to be addressed. And sometimes when your body's trying to communicate with you, it communicates with a whisper. We tend to forget. Or sometimes it communicates with a shout. And sometimes we kind of put that aside, we pay attention to it, and then we forget about it, we put it aside. Or worst case scenario, which brings a lot of people into our offices, is that it communicates to you by kicking your ass, putting you on your back, stopping your activities of daily living in your tracks, stopping you from enjoying your quality of life. So learn to listen to these signals differently. So pain is a signal. Pain is not the problem. So we're not going to treat pain. We're not going to manage pain. Let's focus on finding the underlying issue that created the pain in the first place. Consider this illness-wellness spectrum or illness-wellness continuum. So most people, when they come in through our doors, they come with some type of symptoms. So they're more on the left end of symptoms and signs. So they're only managing their health when they notice the alarm, notice the warning sign. So they're left of that neutral point. If you're only responding when there's a crisis, then you're living in the red. You're living in the path towards the left, towards premature death. Hopefully by the time you finish this workshop, we'll move you further along the spectrum towards the right, where you have at least more awareness, at least more education, and then give you the tools to start growing towards a wellness lifestyle, a wellness approach to approaching your problem. So now here's the kicker. Most people tend to think, hey, doc, I don't have any pain in my body. I don't have any pain in my lower back. Therefore, I must be fine, right? I must be healthy. The absence of pain must mean that I'm healthy. Here's a problem with that logic. Is it possible to have a cavity in your mouth without pain? Is diabetes at its early stages? If you don't have pain with diabetes, does that mean that you're healthy? Early stages of cancer, stage 1, stage 2, before it metastasizes. Sometimes it's painless. Does the absence of pain mean that you're cancer-free? Absolutely not. Heart disease. Does the absence of pain when you have high cholesterol or plaque of the arteries, does that mean that your heart system, your vascular system is healthy? No, it doesn't. Within the column of your spinal cord, 10% of those nerve fibers are sensory fibers. They carry sensations, allows you to sense your surroundings. The other 90% is split between motor fibers that controls motion, movement, function, and the other half of that, the other 40% that controls other functions of the body, other regulatory functions, your organs, your heart, your lungs, your fight or flight response. So 90% of everything that's happening in your body is controlled by the fibers and the nervous system that you don't feel. Your body only uses 10% of your nervous system to carry pain signals. Only 10% or less. That means the other 90% of your nervous system, the other 90% of the spinal cord of the nerves that communicates throughout your whole body, they're responsible for function. So if you're only relying on pain to determine if you're healthy or not, then you're ignoring the other 90% that your body needs to control regular function. So do you want to wait till the 10% alarm goes off? Or do you want to check to make sure that the other 90% of your nervous system that doesn't carry pain signals is being protected and function at its full potential? Okay, here's a $1 million question. Is your current lifestyle that you're living right now, is it helping or hurting the other 90% of your nerve fibers that don't carry pain? There are many people who have no clue about how intertwined the structure of the spine, the bones, and the nervous system, how intertwined they are with one another. In fact, have you ever had an opportunity to look at a dead body or cadaver, which pretty much all chiropractors have had to look at the first 2 years of chiropractic college, chiropractic school, we've all seen that there's a mesh of nerve fibers that surround your spinal column, right? There's a mesh, right? Kind of like a spider web. Now, this is one of my most favorite images that illustrates how interconnected your spine is with your nervous system. So think of a fuse box. And to protect your house, protect whatever electrical appliance is attached to that fuse, the switch in the fuse box shuts off to prevent further damage. So your nervous system is the master control system of your body. There's no cell, tissue, organ in your body that's not directly innervated or connected to your nerve, the brain, the spinal cord, and your peripheral nervous system, or the nerve that exits your spine that goes towards other parts of your body. To protect your lifeline, you have a skull that functions as a helmet, and your spine itself acts as a suit of armor that surrounds and protects this lifeline that keeps you functioning, moving, and basically keeps you existing day in, day out. Your nervous system is the communicating network of your body. Let me say this again. Your nervous system is the communicating network of your body. It's so intertwined. In fact, and I'm going to geek out a bit here, right? I'm going to get a little bit nerdy. There's a long nerve that your body has. It's called the sympathetic chain ganglion. It connects from your cervical spine. Well, hold a second. There's a jet flying overhead. All right, now it's gone. Okay. So there's a long, thin, fragile nerve that extends from here all the way down the front of your joints, your spine, to your lower back, to your sacrum, actually to the base of the sacrum, called the sympathetic chain ganglion. And that small, thin nerve is not a pain-carrying nerve, but it's a function control nerve. So it controls other functions of your body that are responsible for rest and digest and recovery. It also helps to regulate your fight or flight response. So it's a very crucial nerve for regulating how your body responds to stress. Does it spike it up or does it go down? Is it upregulated or downregulated? Look at how intimately close it is to your joints, to the discs, to the openings. So if you have any type of irritation or damage or stress to the disc or to the openings where the nerve exist, then this lengthwise nerve, this nerve that runs lengthwise, is also going to be affected as well. And that's the reason why when people have low back pain, they often tend to have other disruptions of their functions of their body as well. Sometimes digestion, sometimes be able to go to the bathroom, sometimes sexual function, other times breathing, other times it's, you name it. There are many organs that are interconnected to this sympathetic chain ganglion. So here's what happens when your body goes through this fight or flight response. Either you're being chased by a tiger or you feel that your life is threatened and endangered, or perhaps you got the simple stress of PSLE or schooling or O-levels or deadlines or taxes or family stresses. Your body doesn't know anything different, but it reacts exact same way. So here's what you tend to notice. Your blood pressure goes up, correct? Your heart rate increases. Your digestive system gets disrupted, doesn't function properly. Often it slows down. What also happens is that your sex drive, libido, disappears or it diminishes. You don't really feel you're in the mood for getting it on when you're under stress, correct? What about your serotonin? And your serotonin is your happiness chemical. Everybody needs to have a certain level of happiness chemicals inside the brain. Otherwise, we don't feel happy, we get depressed. Those get suppressed. Serotonin production goes down. Also, when you're under that fight or flight response, when you're under strain or you're under a type of stress, now your muscle tone increases. Muscle tone, remember that, muscle tone. Muscle tone, not just on the big muscles of your neck and shoulders and hands and just in your overall body. The small muscle tone that holds your spine in place gets tight, gets taut, increases. And that can also disrupt your alignment as well too. You have more fear, you have more anxiety. That increases when you're under stress. And your immune system gets suppressed under high levels of stress. All those are inherently designed in you to protect you in fight or flight responses for short periods of time. It's not designed for long periods of fight or flight response. But that's how we're living nowadays, unfortunately. And that's how a lot of us right now in this COVID crisis, when we're cooped up indoors, we're definitely experiencing more stress, more emotional stress, less serotonin, but also definitely more muscle tone that can create back issues and low back pain that warrants you being here today listening to this. So if you're interested in living your life in a way that leads away from chronic disease because of stress on your nervous system, hey, raise up your hand. That's me too as well. So at this point, if you're ready to move your health further to the right of that wellness paradigm towards awareness, education, and growing towards a high level of health and wellness, past the neutral point, then be ready to embrace a different premise of what you feel health is, or what you believe health is. Here's a main premise I need you to understand. Being healthy is normal. Being unhealthy is not normal. So embrace that idea of being healthy is normal. It is normal to be healthy. You also need to understand that your body is smart. It is intelligent. It has an inborn natural intelligence that you don't think about, that is programmed to create new life, create new cells, develop more new tissues. Almost like when your baby's being born, you don't think about it. 9 months later, you have trillions of cells later, you have a brand new baby that starts from 2 cells. Or when you cut yourself, the skin heals, the cut heals. When you break a bone, the bone heals. That's an inborn intelligence that you think about, that you don't have to think about, that happens automatically to make sure that your body functions as you exist, as you live. Now, another part you need to stress as well too, we mentioned this before, your nervous system is the master control system in your body. If you cut off the connection between the brain through your spinal cord along the nerves, if you cut it off anywhere along that pathway, anything downstream will die. Also, your spine is designed to suit you or fit you like a suit of armor to protect your spinal cord, protect your brain, and to allow your body to function in a gravity weight-bearing environment and allow it to move without damaging nerves. And get this, at this time right now in our lives, everybody's going through stress because of this COVID outbreak. We're indoors, we're not working, we're concerned about our finances, our family, we're concerned about other people around us, we're concerned about the uncertainty of this situation. So yes, there is stress. We all are affected by this. But let's also equip ourselves and make sure our body's healthier so we can adapt to the stress better and not experience the overwhelming negative effects of this onslaught of stress that we're in the middle of right now. Now, there are a couple of types of stresses that will disrupt your brain-body connection that interferes with your body to stay alive and to function properly. Now, the 3 main causes of the stress, and we mentioned the first one before, mental stress, our emotional state, right? When you're in that fight or flight response, it creates excess muscle tone, and you have muscles that attach to your spine that can cause that muscle tone to disrupt your alignment, causing it to pull to one side or another side, or pull forward or pull back. So any muscle that attached to the segments of your spine, or the muscles that are responsible for balance and symmetry, they get disrupted by abnormal stress, okay, that fight or flight response. So we want to be able to reset that, and that's what we help through with chiropractic. So that's the most common stress that we're all experiencing right now, that muscle tension stress. Also, another stress comes from is toxins, what you allow into your body. Another source of stress that can affect your brain-body connection and it can affect the health of your spine comes from what we allow into your bodies through nutrition, or through what we smoke, or through the pollution that's around us, or through the water that we absorb, or through chemicals, through medications, through vaccines, so other ingredients that we're exposed to knowingly and unknowingly. That can create a chemical imbalance in your spine, or a chemical imbalance in the bloodstream or in your fluids of your body, and your muscles respond to this chemical imbalance. Sometimes the response is to create tension or additional tone. And that additional tone that can create a misalignment like this, misalignment like this, misalignment like this. Basically, abnormal chemistry inside your body can create abnormal muscle tone, not just in the bigger muscles, but also in the smaller muscles that keep your spine in proper alignment. Now, the last but most common source of stress on your nervous system comes from trauma. You got trauma that's very typical. When you think of a fall or spill, like if you've ever slipped inside the shower when you're mopping the floor, you lose your footing, you land on your back, you land on your coccyx or your bottom bone, calling it your tailbone. Or perhaps you had the opportunity to walk outside, ascend the stairs on the MRT, and you lose your footing, you slip, and you try to grab yourself, you try to grab onto something, and then you distort your back and it doesn't feel the same way afterwards, you feel a strain. That's another form of trauma. Sudden impact, sudden disruption to the balance of your spine. That trauma can also come from something that you do in sports. If you play soccer, that's a repetitive trauma. If you play football, when you bang the ball on your head, or you dive for a ball, like dive for a cricket ball, or even sports such as badminton, that can create a trauma enough to disrupt the balance in your nervous system inside your spine. You also have trauma from car accidents, often overlooked, falling off a bike, falling off a motorbike. A fender bender, something as minute as 10 kilometers an hour, has enough whiplash effect, pendulum effect to create soft tissue damage that affects your spine negatively. That shows up as scar tissue later. So we always ask the question, have you been in a car accident? No matter how small that you think it was, what type of impact or trauma has your body been exposed to? If you're in the national service, gentlemen, Singaporeans, National service, that long trek, the backpack on your back, or the jumping exercises. Think of every type of trauma you've experienced in your national training. You probably had to push aside the pain to get through the training, but more than likely you experienced some type of a major trauma to it. Some people recovered from it, other people don't. And childbirth. Childbirth is another type of trauma as well. People often overlook that, but that's also another source of trauma to the spine affecting the nervous system. Microtraumas. Microtraumas are more common and overlooked. Microtraumas come from how we sleep in a bad position, either on your stomach with your head turned, head tilted back, or microtraumas coming from how we're sitting down at a desk for long periods of time, looking at a screen, looking at a laptop, or looking at your phone, which nowadays, since we're indoors during this COVID outbreak, we're going to see a lot of effects of microtrauma. Now, about the offices, well, here's the reality. We see a lot of white-collar injuries, meaning that office-based injuries from being static, from not being enough motion. Our body is designed to be in motion. We're not designed to be sitting static, sitting still. In fact, when you're standing, your neck, mid back, and lower back maintain the ideal alignment. You have your springs in place. You have 3 suspension springs. But when you're sitting down, your head comes forward because you're in front of a monitor, and your lower back actually starts to flatten out because when you're sitting down, your core muscles weaken, they shut off, and now you're in an unbalanced loaded position. Now your body looks old, looks aging when you're sitting down. But you're not sitting down for an hour at a time every single day. We're sitting down when we're at work, we're sitting down when we're eating, we're sitting down when we're commuting to and from work. But now, because of COVID, we're indoors, we're sitting down way too much. So now this is an adapted, abnormal, imbalanced position that strains the discs, stretches the nerves, and causes irritation that creates inflammation that leads to pain. So sitting is like the new smoking. Do you remember many years ago, they said that smoking decreased your lifespan by 10 to 15 years. They've done some studies. They were in denial for some time about it, but they found that smoking decreases longevity and lifespan. Now, they've done studies on the effect of hunching of the back, loss of proper function of your spine. That also is responsible for decreasing longevity as well, decreasing lifespan. All right, so the stresses that interfere with the brain-body connection, allowing your body to thrive, allowing your organs to work and everything to be coordinated. And also the stress that can disrupt the conduit that surrounds and protects your nervous system. Those stresses can come from, as I said before, toxins or anything that we allow into the body that creates a shift, a chemical imbalance, or stress can come from our mental state, our mental stresses that can alter muscle tone and also change spinal behavior, spinal mechanics. And stress can come from trauma, macro trauma from falls or collisions or impacts to the spine, things you even forget about in the past, and micro trauma from our lifestyle. Not only what we did before the COVID, but also what we're doing now from being static and mobile, as I mentioned before, about the typical microtraumas. All these things lead to a condition called a movement deficiency syndrome. You never heard this term before, so I'm going to say this again. Movement deficiency syndrome. Let me explain exactly what that means and what that entails. So it starts off with joint misalignment, and that's simply when your spine that should look straight from this angle might be crooked like this, or it might be crooked like this, rotated out of place. And the misalignment from this angle might be a global or regional misalignment, or a single segment that's misaligned. It can also happen from the side, where from this angle you need to have the curves in place, but then when your joint or joints are misaligned, it could be happening globally, or even just segmentally at the smallest part. Now the next part is soft tissue damage as a result of long-term misalignment that doesn't get repaired and fixed. When you have enough tissue damage, then you need to develop inflammation. When you have inflammation that doesn't get resolved or fixed or removed from your spine and removed from the nerve tissue, then your body starts to react by creating a muscle spasm, kind of preventing you from moving. When you don't have enough movement of the segment or region, then you start to lose imbibition, okay, which is nourishment of the disc, nourishment of the nerve tissue, nourishment of the joint due to movement, because you can't move. You're locked up because of the muscle spasm. And then the last stage, when you have long enough imbibition, lack of nourishment going in and out of the joint, then you create a joint fixation, which means that now you're losing health to the disc and it starts to deteriorate and it locks up. So The joint misalignment, the soft tissue damage, the inflammation, the muscle spasms, the lost imbibition, and the joint fixation all leads to what we call intervertebral joint dysfunction. And that's the allopathic general medical term that describes everything that I'm describing. Now, to simplify that, because that's a mouthful, we in chiropractic refer that as vertebral subluxation. Vertebral subluxation. Or even simply, we use the jargon subluxation. Same but different. Okay, we just use a different terminology for it. That is what we're looking for when you come into our offices to detect for the movement deficiency syndrome that you might be living with. So you might be wondering, how do we as chiropractors find and detect subluxations? So I'm going to speak for what we do in our clinic. I can't speak for all chiropractors, but we pretty much do close to the same thing. So here's what we're going to expect. The first step is getting a complete health history. We want to find out more about your past to determine and get clues about what might be happening in the present. The next step is to looking at your posture from the front and from the side. We're going to be looking at certain key landmarks to see if they line up. Next is to check your joint movement globally of how you turn and move your body, left to right, side to side, front and back, and also segmentally as well too. Is able to move freely, relatively freely, in 3 different planes of motion, X, Y, and Z axis. The next step is also going to involve a static palpation or a static joint challenge. So when you're lying flat on the table, face down, I'm going to be placing my fingers, or typically a chiropractor will place their fingers along the sides of your spinous process, from the bottom all the way to the top, checking both sides. Because when you're flat, your brain should be telling your muscles to go limp and relax, because it's not fighting gravity, so there's no reason for them to turn on. These are the segmental postural muscles. They should be relaxed, should be no abnormal muscle tone, should be equal. But if there's a disconnection anywhere along that pathway, any type of interruption or blockage of those signals getting through your spine, what we're going to feel is increased tone, tightness, tension, tenderness, asymmetry on the left side versus the right side. So these are the tools and cues that we use to determine, hey, we believe you do have a vertebral subluxation. Now, sometimes it also involves diagnostic imaging. So we do diagnostic imaging a lot in our clinic. Not all chiropractors use this, but here's what I've noticed in the last 14 years of practicing. The x-rays, at least weight-bearing x-rays, tells a story as to what might have been happening in your lifestyle that led up to the point or led up to the problem that you present with us today in our clinic or at that time. MRIs, yes, they're important, but if you're coming to us with an MRI, chances are someone had ruled out that you don't need surgery, or you were given an option of a surgical approach or to go a different route. So if you're not a surgical candidate, and that's been ruled out by your orthopedic surgeon or MD, then more than likely you would be a chiropractic candidate. And there's an 80 to 90% chance that you'll benefit from what we do in our office. Okay, what to do if you do suspect you have a subluxation? Well, if you live in a country that still has chiropractors still working and the clinics are open, go get yourself checked out by a chiropractor or a chiropractic physician. Okay? Same but different, same terminology. However, if you live in a place that does not have chiropractic clinics that are open, because some places are closed during this COVID crisis, especially Singapore, well, that's what this is all about. What can you do at home in the meantime until our clinics are open and we can see you? So I'm going to be sharing some very helpful tips. Five key simple things you can start doing today that's going to make a difference and protect your back, protect your spine, and keep you functioning better until this crisis is over. Number 1, simply start moving more. We're not moving enough, especially during this COVID crisis. Of course, we are no longer outdoors. So if you're indoors and you're not allowed to go outdoors, simple movements at home might involve jumping jacks or doing full body weight squats or doing burpees. Oh, burpees, I know. Simple movements may also involve jumping on a trampoline if you have one at home. Now, if you're in a place or country that allows you to go outside for moments at a time, go for walks, go for a walk, go for a run. Simple movements such as that, if you're allowed to go outside. If you're stuck at home because you're working all the time, you're desk bound at home, take breaks every 4 to 5 minutes, every hour, get up and move, go back to sitting down. All these different types of movements creates imbibition for your lower back and for the discs, which allows fluid to get in and out, which is basically essential spinal hygiene. Number 2, get strong. We're not talking gun show strong, but we're talking core stability strong. We're talking getting the muscles in front of your gut or your lower abdominal muscles stronger, and getting the muscles that are align your spine from the bottom, from your tailbone or from your sacrum, all the way along your spine to the top. My favorite exercise is the plank. Love it. It's an all-in-one exercise, one size fits all, safe for all ages, beginner to advanced. If you've never done a plank before, there's many videos online that shows you how to do it. So check out what's here, or find a link down below, or just Google plank. Okay, there's so many people showing how to do this exercise. Number 3, foam roll. I love using the foam roll, rolling out your spine. Here's what it looks like. So I did a video years ago for my patients at another clinic I used to work at in the USA, United States. So if you don't know how to foam roll, or if no one has ever shown you how to use a foam roller for your spine, this will teach you how to do it step by step. Or if you have a favorite video, check it out as well too. Great for the spine. It's next best thing to us not being there. Okay. Number 4, hydrate. Drink a lot of water. Pass the pee test, meaning that if you're peeing clear, you probably have enough water. If you're not peeing clear, drink enough water until you're peeing clear. What happens is that if you're not drinking enough water, your body draws water. So if you're dehydrated, your body draws water from the discs first because it's full of water. It's pretty much 80% water. So that's what your body uses as a resource it taps into to maintain blood pressure when it feels that it's dehydrated. So you got to replenish that as soon as possible. And replenishing the water also allows for hydration. Once again, normal spinal hygiene, drinking a lot of water. Last but not least, number 5 is find a simple mobility exercise routine. There's so many out there online on YouTube, so many to choose from, so many great ones. My favorite I found is by this one personal trainer and health coach. His name is Brian DeCastro, and he does a 7-step mobility exercise routine, or 7 zones. So check it out. Okay, and also there's a link below if you want to know how to do that. He also walks you through step by step, very clearly and succinctly as to how to do it for yourself. I like recommending it to patients. I do it for myself, but I also recommend it to others because it's very easy, very simple to follow. Wow, everybody, that's it. That's a wrap. That's the end of your Bulletproof Your Lower Back workshop. Thank you so much for your undivided attention. Man, it means a lot, especially this time right now where we're competing against Netflix. All right, so that does mean a lot. Thank you so much. But more importantly, I had fun doing this, and I hope that you had fun learning as well too. So it wasn't a dry 40-minute talk or workshop. So if you have any questions or concerns about your own needs, just pop them in the comment below, and we'll answer them as soon as possible. Or hopefully, they were being answered as we were watching this. Regardless, we're going to answer them. So if you live abroad, you don't live in Singapore, hey, let's talk through this comment box. If you live in Singapore and you want more follow-up for your own unique needs, your own concerns, schedule a consult, one-on-one consult with one of the doctors. Just put the request in the comment box and we can reach out to you. Guys, folks, everybody, I had fun. Thank you so much. And hopefully we get to talk and interact in the next workshop in the next couple of weeks. Take care. Peace out. This is Dr. Max. Deuces.